Assalamualaikum and a very good morning to our Madam Lecturer Puan Nurhaini Majid and to all fellow members of the audience. Today, our group from Group EPJJ of Semester 6 from Group NHSN6 will present a title of Lymphoma for today's presentation. First of all, I would like to introduce our members first. Me, as myself is Muhammad Hafizullah Mahjali, and then Ahmad Furkan, then Nazulia Sanik, Siti Masyarah Abdul Latif, and Rosmah Menan. I hope all of you will sit back, relax, and enjoy our presentation. Any question can be asked later after the presentation. Thank you.
This presentation consists of definition, pathophysiology, the risk factor, clinical manifestation, diagnostic test, medical treatment, nursing management, and nursing diagnosis. Okay, we go through for the definition. This anatomy and physiology of the lymphatic system. So the lymphatic system is have a spherical lymph node, right lymphatic ducts, and so on. For popliteal lymph nodes, lumbar lymph node, and others. Okay, the definition of lymphatic system is the lymph node, a small collection of lymph tissue that occurs throughout the body. The lymphatic system involves lymphatic channel that connect the thousands of lymph nodes scattered throughout the body. The lymph flows through the lymph nodes as well as through other lymphatic tissue, including the spleen, tonsil, the bone marrow, and the thymus gland. These lymph nodes filter the lymph, which may carry the bacteria, virus, or other microbes. At infection site, large numbers of these microbial organisms collect in the regional lymph nodes and produce the swelling and tenderness typical of localized infection. This enlarged and occasionally confluent collection of lymph nodes called lymphadenopathy are often referred to as swollen gland in some areas of the body, such as the anterior part of the neck. They are often visible when swollen. Two major subtypes of lymphocyte B, lymphocyte T, and lymphocyte T. B lymphocyte produce antibody. The antibody essentially alert other cells of the immune system to recognize and destroy these intruders, also known as a pathogen, which is the humoral immunity. The T cell, when activated, can kill the pathogen directly. T cell also help in the mechanism of immune system control to prevent the system from inappropriate overactivity or underactivity. The cell-mediated immunity. After fighting off invader, the sum of the B and T lymphocyte, remember, the invader are prepared to fight it off. It returns. Lymphoma. We go through lymphoma cancer. The definition of lymphoma is a cancer of lymph nodes. Lymphoma are cancer that begin by the malignant transformation of a lymphocyte in the lymphatic system. This tumor usually starts in lymph nodes, but can involve lymphatic tissue in the spleen, the gastrointestinal tract, for example, the wall of the stomach, the liver or the bone marrow. Many lymphomas are known to be due to specific genetic mutation. Abnormal lymphocyte, a type of white blood cell that fight infection, become lymphoma cells which multiply and collect in lymph nodes. Over time, this cancerous cell impair the immune system. there have two types of lymphoma: the Hodgkin lymphoma and non-Hodgkin lymphoma. These two types occurs in the same place, may be associated with the same symptom, and often have similar appearance on physical examination. However, they are readily distinguishable via microscopic examination. For the Hodgkin lymphoma, it's developed from a specific abnormal B lymphocyte lineage. For the non-Hodgkin lymphoma, may derive from either abnormal B or T cell and are distinguished by unique genetic markers. The difference between Hodgkin and non-Hodgkin lymphoma is by examining the cancer cell under a microscope. If in examining the cell detect the presence of specific type of abnormal cell called a red stable cell, the lymphoma is classified as a Hodgkin. If the red stable cell is not present, the lymphoma is non-Hodgkin, classified as non-Hodgkin lymphoma. Okay, we go to my friend Muhammad Kafizullah Rajali for the pathophysiology.
Thank you, Mr. Ahmad Furkan, for the wonderful introduction of the lymphoma. Now, I am Muhammad Hafizullah Muhammad Rajali will continue to delve into the lymphoma. I will touch a topic about pathophysiology, risk factor, and clinical manifestation. As the abnormal cells multiply, they may collect in one or more lymph nodes or in other lymph tissues such as the spleen. As the cells continue to multiply, they form a mass often referred to as a tumor. Tumors often overwhelm surrounding tissues by invading their space, thereby depriving them of the necessary oxygens and nutrients needed to survive and function normally. In lymphoma, abnormal lymphocyte will travel from one lymph node to the next lymph node, and sometimes to remote organs via the lymphatic system. And finally, while lymphomas are confined to lymph nodes and other lymphatic tissue, they can also spread to other types of tissue almost anywhere in the body. Lymphoma development outside of lymphatic tissue is called extranodal disease. Risk factor. The first one is age. Generally, the risk of non-Hodgkin lymphoma increases with advancing of our age, while Hodgkin lymphoma in the elderly is always associated with a poorer prognosis than that observed in the younger patients. After that is infection. A person with HIV, Epstein-Barr virus, and maybe Helicobacter pylori. It is a bacterium that resides in our digestive tract, and also an infection of hepatitis B or hepatitis C virus. Other than that, it's a medical condition that compromises the immune system, such as I mentioned before, HIV, autoimmune disease such as SLE, and use of immune suppressive therapy. It is always used in following organ transplant and inherited immunodeficiency diseases. Exposure to toxic chemical also contribute to the risk factors. Person who works in a farm are always exposed to the certain toxic chemicals such as pesticide, herbicide, or benzene, and other solvents. It is also related to barber because they are always use hair dye, and it is much higher risk if the dye used is manufactured before 1980. And finally, the most common factor in all diseases is genetics. A person with family history of lymphoma will always have a higher risk to get lymphoma. A clinical manifestation. The first sign of lymphoma is always a painless swelling in the neck, under an arm, or in the groin. Lymph nodes or tissue elsewhere in the body may also swell.
The spleen, for example, often become enlarged in lymphoma. The enlarged lymph nodes sometimes causes other symptoms by pressing against a vein or lymphatic vessel. We could see that if there is a swelling in our arm or our leg and a sensation in our nerve, such as a pain, numbness or tingling, or in our stomach, when we're eating a meal, we always feel an early sensation of full. Enlargement of the spleen may also cause abdominal pain or discomfort. And then there was usual symptoms such as fevers, chills, unexplained weight loss, night sweats, lack of energy, and itching, most commonly in the lower extremity. It could be explained with such a variable severity. This may be from asymptomatic to extremely ill, and the time course it is may evolve maybe within a weeks or months or maybe also a years. A systemic manifestation. Firstly, we may develop fever, and then it proceeds to night sweats, and then weight loss, and sometimes anorexia, and finally pruritus. Local manifestation, we could see a lymphadenopathy or splenomegaly. It is the most common sign, and any tissue potentially can be infiltrated. Thank you. Now I would like to pass to Nazulia Sanik for the next explanation of the diagnostic test. Thank you.
Assalamualaikum. Thank you to Kafi. Then I would like to continue the presentation with the diagnostic test and treatment. So we go to the diagnostic test. First is the blood test. The blood test is to evaluate the function and performance of the blood cells and other important organs such as liver and kidney. Other than that, blood chemicals or enzymes such as lactate dehydrogenase (LDH) may be determined as well. This is because the high level of LDH in cases in which NHL is suspected may indicate a more aggressive form of the disease. Next is the biopsy. If there any of the swelling such as lump or mass, a sample of tissue from the swelling will be removed from for examination or biopsy. Any of several methods can be used to obtain a biopsy of a mass. First, the core needle biopsy. The core needle biopsy is for masses that can be seen and felt under the skin, and this is also relatively easy to biopsy by inserted a hollow needle to get a small sample removed with the needle. Next, the surgical biopsy. The surgical biopsy involves the removal of the entire swollen lymph node through a small incision in the skin. Then we have the laparoscopic biopsy, which is a tiny inclusion in the skin and inserting a thin tube with a light and a camera on the end. A small cutting tool on the end of the laparoscopic can remove all part of the mass. Then then imaging study will be performed as well, such as in such cases, if there is a palpable mass in the presence of persistent symptoms, imaging studies will be likely to be carried out, such as first is X-ray. In certain parts of the body, such as the chest, a simple X-ray can sometimes detect the lymphoma as well. Apart from that is CT scan. CT scan is the test provides a three-dimensional view and much greater details and may detect enlarged lymph nodes and other masses anywhere in the body. MRI scan will be performed as well, which MRI will provide better definition that CT scan in certain parts of the body, especially in the brain and the spinal cord. Apart from that, positron emission tomography, PET scan, also may be determined to detect areas in the body that are affected by the lymphoma. So next is bone marrow examination. Examination of the bone marrow is necessary to see if the bone marrow is affected by lymphoma or not. This is done by collecting a biopsy of the bone marrow itself, and then sample are usually taken from a hip bone, and pathologists will examine the bone marrow under a microscope. Then bone marrow containing certain types of the abnormal B or T lymphocyte count will determine the confirmation of the lymphoma. That's all for the diagnostic treatment. We'll go further on the medical treatment. So medical treatment may involve any of the following either modalities: chemotherapy, radiotherapy, biological therapy, and stem cell transplant. Very often, it is likely a combination treatment, two or more of the above modalities. This is dependent on what type of the lymphoma and various prognostic features of the lymphoma itself. So, let me go further on the medical treatment, such as chemotherapy. Chemotherapy is a useless drug to destroy fast-growing cells, such as cancer cells. Other drugs used to treat lymphoma is including targeted drugs that focus on specific abnormalities in the cancer cells. Immunotherapy drugs use your immune system to kill cancer cells. And then apart from that is radiation therapy. This is used high-powered beams of energy such as X-ray and protons to kill the cancer cells. Other than that, a bone marrow transplant also will be one of the treatment, this is also known as a stem cell transplant, involve using high doses of chemotherapy and radiation to suppress the bone marrow. Then a healthy bone marrow stem cells from body or from a donor are infused into patients' blood, where they travel to bones and rebuild the bone marrow itself. So that's all for the diagnostic test and medical management. I will pass to my colleague, my friend, to present further on this information.
Hi, thank you, Madam Nazilia, for the explanations about the diagnostic test. Now, I am Rosma, will continue with nursing management. So, as a nurse, we should know how to assess the patients by obtaining health history, focusing on fatigue, fever, chills, neck sweat, swollen lymph nodes, and history of illness or therapy causing immunosuppression. Evaluate splenomegaly, hepatomegaly, lymphadenopathy. Also, assess the vital signs of the patients regularly, such as BP, pulse and respiration, also temperature. Okay, the next one is monitor the support system received by the patients. Next, assess any break in skin or mucosal integrity due to the therapy. Next, assess the psychological states of the patients. Also, assess the FBC and other investigations regularly. The second one is a patient's education and health maintenance. This is a very important to nurse to know how to educate the patients. The first one is teach patients about infections precautions. Encourage frequent follow-up visits for monitoring of FBC and conditions. Next, teach patients about risk of infections, such as any redness at the skin. Okay, the next is teach patients how to take medication as ordered and instruct about possible adverse effect and management. Okay, The next one, explain to patients that radiation therapy may cause sterility. Men should be given opportunity for sperm banking before treatment. Women may develop ovarian failure and require hormone replacement therapy. Okay, for the next one, reassure patients that fatigue will decrease after treatment is completed. Encourage frequent naps and rest periods. Okay, the last one, provide patients and family with information about resources in the community and other support groups.
Hi, Assalamualaikum warahmatullahi wabarakatuh. Thank you for Madam Rosma. I will continue with the nursing diagnosis. Okay, they have two nursing diagnoses. Firstly is risk for ineffective airway clearance related to enlarged airway edema. So, the goal for this nursing diagnosis is patient can be breathed normally after nursing intervention implemented. Okay, we go to the nursing intervention with the rationale. First, as a nurse, we must assess patients' respiratory rate, depth, and rhythm. This to detect any abnormal changes in respiration, which may indicate the continued respiratory effects that requiring intervention effort. Okay, second is place the patient in a comfort position, usually with a high phallus or sit-up. This to maximize the lung expansion, lower respiratory work, and reduce the risk of aspiration. The third is educate patient with deep breathing exercise technique. Okay, this to help improve gas diffusion and expansion of small airway. Give the patient some control over breathing to help reduce anxiety. For the intervention is administer oxygen therapy as ordered by physician. This is because the effect of oxygen therapy will open the respiration passageway. Okay, so the evaluation for the nursing diagnosis is patient can breathing normally as evidence of free from dyspnea or cyanosis. Okay, then we go to the second nursing diagnosis, which is risk for infection due to low immune system. The goal for this nursing diagnosis is patient will free from any infection after nursing intervention implemented. Okay, we go for the intervention and rationale. First, care for patient in protected environment with strict hand washing observed. Protected environment, maybe you need to isolate patient. Okay, the rationale, hand washing before and after touch the patient can break the chain of infection. Secondly, avoid any invasive procedures such as urinary catheterization because unstressed invasive procedure may introduce infection to the patient. Third, assess the temperature and vital signs, breathing sounds, level of conscious, skin and mucous membranes frequently for sign of infection. This for early recognition lah. Okay, this is because fever may indicate the infection. 4. Notify the physician if fever greater than 38.3 darjah Celsius or they got any changes in condition. The rationale is high-grade fever require further investigation such as blood culture to rule out the factor. Okay, so the evaluation for this nursing diagnosis is patient free from infection as evidence no fever along hospitalization. Okay, that's all from our group. Thank you.